Welcome to Easy Anatomy. I'm going to cover external carotid artery and its branches. And I mentioned before, usually you talk about the beginning or the origin, the termination, okay, branches. So what is the origin of external carotid artery? External carotid artery, as you know, is starting as one of two terminal branches of common carotid artery at the level of upper border of thyroid cartilage, and it is the one which usually has angle with the common carotid. So this is common carotid artery, external carotid artery, internal carotid artery. External carotid artery, so the level or the beginning is the upper border of thyroid cartilage. If you extend the line from here, this is the thyroid cartilage, okay, is going to be at the level of the upper border of thyroid cartilage, okay. Then it extends upward and travel through parotid gland before it ends as two terminal branches. What are the two terminal branches? This one, which is called maxillary artery, and the one which you go to the scalp and the temporal region is called superficial temporal artery. So this is the level, or this is how it ends: maxillary, and we talked about maxillary artery before, superficial temporal artery, okay, and both of them, they originate inside the parotid gland, So this is parotid gland, and the division happen inside the parotid gland behind the neck of the mandible. What are branches? Branches of external carotid artery, it has three branches from the front. This artery, which descend to the thyroid gland, is called superior thyroid artery. So this is the first one from the front, is called superior thyroid artery, and is supplying thyroid gland. Is going to thyroid gland, okay, thyroid gland. The second one, which is ascending deep to hypoglossus muscle, is called lingual artery. So keep in mind that it is traveling deep to hypoglossus muscle, and the hypoglossus muscle, as you know, is attached to the posterior part of the tongue, side of the tongue. So this is tongue, hypoglossus muscle, and the artery go deep to the hypoglossus muscle. Then anterior here is going to the under surface of the tongue, where it go to the tip of the tongue and anastomose with the one from the other side. This is lingual artery. The level of its origin at the opposite the greater horn of hyoid bone. Remember this. This is the hyoid bone. Usually it is originating opposite the tip of greater horn of hyoid bone. Okay. The third branch from the front is facial artery, and the facial artery has cervical portion, ascend deep to posterior below of digastric and deep to the mandible, then again descend and appear in the face, and we have the facial part. So we have cervical and the facial part. We're going to talk about that in detail. So this is the facial artery. So we have three branches from the front. Again, we have superior thyroid artery, we have lingual artery, we have facial artery. Behind, if you remember, here is the mastoid process. Which muscle attached to the mastoid process, deep surface of mastoid process, is posterior pillow of digastric, And the posterior belly of digastric, if you remember, if I extend it, is going to hyoid bone and connect to the anterior belly. So I am cutting it here, and just to show you that we have two branches from posterior surface of the external carotid artery when ascend above the posterior belly of digastric behind the auricle. This is the auricle. This is the posterior auricular artery. Posterior auricular artery. Okay. The other one at the lower border of the posterior belly of digastric and go to the occipital region. This is the occipital artery, and actually you will notice it in the upper part of the posterior triangle. Upper part of the posterior triangle. So this is the occipital artery. So you have posterior auricular, you have occipital, and you have posterior belly of digastric. Separating both arteries from each other. Okay. Then the last branch coming from the deep surface of the artery, this branch is called ascending pharyngeal artery. It's called what? Ascending pharyngeal artery. So it's coming from the deep surface of the artery, medial surface of the artery, and ascend to the pharynx and the side of the pharynx and give multiple branches. We're going to talk about them. So this is the ascending pharyngeal artery. Ascending and going to the base of the skull. So how many branches we know now for external carotid artery? We have 3 from the front, superior thyroid, lingual, facial. We have 2 terminal, maxillary and superficial temporal. We have 2 from the posterior aspect, posterior auricular and occipital. Then we have 1 from the medial surface of the artery is called ascending pharyngeal artery. It's called the ascending pharyngeal artery. Let us talk about important branches. We already covered the maxillary before, and right now I'm going to cover superior thyroid, lingual, and facial. Superior thyroid artery, here is the external carotid artery, is going to send this branch, which is called superior thyroid artery. It's common carotid, internal carotid. Here is the external carotid artery. Okay, so external carotid artery, the first branch from the anterior aspect is superior thyroid. Here is the thyroid gland. If you remember, it is H-shape gland. The artery, when it comes to the apex of the loop, is going to split into posterior and anterior branch. Posterior and anterior branch. And which artery here, if you remember, there is subclavian artery coming from brachiocephalic in the right side. This is subclavian, and this is common carotid artery. External, internal. This is internal carotid artery. Do you remember which branch coming from subclavian artery here divide into 3 branches? This is thyrocervical trunk, which is split into suprascapular, transverse cervical, and the inferior thyroid artery. You see inferior thyroid artery ascend behind carotid sheath, then descend down here and go to the posterior surface of the gland. Posterior surface of the gland also. Okay, so this is the inferior thyroid artery. It's going to anastomose with branches from the superior thyroid. So keep in mind superior thyroid and inferior thyroid anastomosing with each other. But inferior thyroid artery is coming from where? Thyroid artery from subclavian artery, from the thyrocervical trunk. However, you have superior thyroid artery coming from external carotid. Okay, the superior thyroid artery supplying upper half of the thyroid loop and also upper third of thyroid loop and the upper half of thyroid isthmus. This is the isthmus and this is the loop. So mostly the upper part of the gland supplied by superior thyroid artery. Superior thyroid artery give branch is called superior laryngeal. If you remember, you have hyoid bone here. This is hyoid bone. Do you remember this muscle is called thyrohyoid muscle? Behind the thyrohyoid muscle there is a membrane. This membrane penetrated by this artery. This artery is called what? Superior laryngeal. It's called what? Superior laryngeal artery. The superior laryngeal artery is accompanied by a nerve coming from vagus. This nerve is called what? Is called internal laryngeal nerve. Internal laryngeal nerve. So this is the internal laryngeal nerve, which is a branch of vagus coming from vagus, and it is sensory for the vocal, for larynx above vocal cord. So keep in mind that you have superior laryngeal artery accompanied by internal laryngeal nerve. The internal laryngeal nerve coming from superior laryngeal, which is a branch of vagus. This is the vagus lateral to the carotid arteries. Then you have this superior laryngeal nerve is going to split into internal and external. You know the external branch. Here is the external branch. Descend with superior thyroid until it reaches to a muscle. This muscle is called what? Cricothyroid muscle. Cricothyroid muscle. So this is vagus nerve, superior laryngeal branch of vagus nerve, split into internal laryngeal and external laryngeal. Okay, the external laryngeal descend side by side with superior thyroid artery. This is superior thyroid artery. However, the internal laryngeal branch is going to be accompanied by superior laryngeal artery, which is a branch of superior thyroid artery. And keep in mind that if there is any surgery on this gland, okay, and you have to ligate the artery, you ligate the artery close to the gland here. Okay, if you go back and at higher level, you might ligate the artery with the nerve, and this is dangerous because it's going to hit the nerve. So you always keep yourself close to the gland. Okay. On the other side, you see the inferior thyroid artery, which is coming from subclavian, okay, getting to the back of thyroid gland. At the end here is going to be accompanied or close to another branch of vagus is called the recurrent laryngeal nerve. Recurrent laryngeal nerve. So if you wanted to ligate this artery, you ligate it away from the gland, but superior thyroid close to the gland. Why? Here to avoid injury of external laryngeal, but here to avoid injury of recurrent laryngeal nerve. Okay, so keep in mind again that vagus nerve, okay, is going to send this branch, which is called recurrent laryngeal also. We're gonna talk about that. So I'm just trying to show you that nerves, important nerves, accompanying some branches from external carotid artery here, especially those branches from vagus nerve. So we're done with the superior thyroid artery, which is important to supply thyroid gland, and it anastomosis with the inferior thyroid artery. If I ask you, tell me any talk about collateral circulation between subclavian system and the carotid system. Okay, here is one in the neck, which is between superior thyroid and inferior thyroid. Of course, the most important one in the base of the brain is circulus arteriosus. Circulus arteriosus, because it is between carotid system and subclavian or vertebrobasilar artery, which is coming from subclavian. Okay, let us talk about second branch, which is lingual artery. Lingual artery is very important artery, okay, and from the name, it is going to the tongue. Here is the lingual artery. Again, here is internal carotid, external carotid. This is superior thyroid artery. And then the second one is lingual. Lingual artery, the level of its origin is going to be opposite the tip of the greater horn of hyoid bone. So here is the hyoid bone. The artery originates at this area, and actually it is crossed by hypoglossal nerve here. This is hypoglossal nerve. Okay, what happened next? You remember which muscle coming from hyoid bone to the tongue? Here is the tongue. And here is hyoid bone. So this muscle is what? Hyoglossus muscle, correct? And deep to hyoglossus, you will see there is a muscle which is called genioglossus muscle. It's going to be deep to hyoglossus. Genioglossus, coming from genial tubercle here in the mandible. So the artery is going to be divided into three parts by the hyoglossus muscle. Until it reaches to the under surface of the tongue. Here, under surface of the tongue, where at the tip of the tongue is going to be, going to form collateral or anastomosis with the other artery from the other side. This is lingual in the other side, and this is lingual also. So they meet each other at the tip of the tongue, in the floor of the mouth. So hyoglossus muscle divides the artery into three parts. This is the first part, part number 1, behind the muscle. Part number 2, deep to the muscle. Part number 3, anterior to the muscle and superficial to genioglossus muscle. This is genioglossus. Okay. So what are branches of this artery? The first part of the artery before hiding under the hyoglossus send suprahyoid, above the hyoid bone. This is the suprahyoid, which anastomosis was the suprahyoid from the other side. So this is suprahyoid artery, supplying muscles, and anastomosis was the suprahyoid from the other side. The second part is going to send dorsalis lingual artery, which is going to the dorsum of the tongue, dorsalis or dorsal lingual artery. The third part is going to send the important branch is called sublingual. It's called sublingual artery. Sublingual. And I have to stop here at the sublingual because it is very important artery. The sublingual, from the name, is going to supply sublingual gland, supplying sublingual gland. However, it also send branches to the mandible. So this is the genial tubercle of the mandible, which give origin to genioglossus. So keep here in mind that here is the mandible. There is vascular canal. This vascular canal inside the mandible receive branch from sublingual artery. So this is mandibular vascular canal. Vascular canal, mandibular vascular canal. So the mandibular vascular canal is very important. Why? It can be either close to the midline or lateral. So you have, if you are going to fix implant in the anterior teeth or lateral teeth, you need to do CT to localize this vascular canal. Otherwise, you might hit this artery, leading to severe hemorrhage, sublingual hematoma, which can be fatal because sublingual hematoma is going to raise the tongue backward and block the airway. So if I ask you again to make it simple, so lingual artery is divided into three parts by hyoglossus. Correct? The first part is going to send suprahyoid branch, supplying muscles, suprahyoid muscle, plus anastomosis with other side. The second one is going to send the branch to the dorsum of the tongue. We call it dorsal or dorsalis linguae or dorsal lingual artery. The third part, the main branch here is called sublingual, and of course the terminal end is lingual artery, which supplies the tongue. Sublingual branch. Sublingual branch supplying sublingual gland and also vascular canal of mandible. The vascular canal of mandible. Anastomose with branches from facial and inferior alveolar arteries. Remember that vascular canal, the sublingual, it is the primary one, it is the main one responsible for supplying these canals. However, also facial artery, don't forget that facial or submental branch of facial, and also inferior alveolar contributing. So these are the three arteries contributing to the vascular canal. Clinical significance of that, you need to, for implants, you need to do CT to localize the vascular canal. Injury of arteries in vascular canal can cause sublingual hematoma, leading to blockage of airway. So you need to pay attention to this artery, very, very important artery, and please, before doing any implants, you need to localize the vascular canal. Sometimes it is symphysial, sometimes parasymphysial, either close to the midline or away from the midline. The third artery, which I like to highlight its branches, is facial artery. Facial artery has two parts. Again, this is external carotid, internal carotid, common carotid. So facial artery has two parts. The cervical part in the neck, which ascend between the gland and mandibular fossa of the mandible, then descend again to reach to the face. In face, ascend oblique until reach to the angle of the mouth, then vertical to the angle of the eye. Okay, so let us say this is the mandible in this area. Okay, it hide deep to the mandible, then ascend again superficial. This is mouth, and here is the eye. Mouth, eye. Okay. All what I need from you to pay attention that we have four branches in the face. This is facial part. This is cervical part. The cervical part is going to send long branch to the submental region. Is called submental. It's called what? Submental, which supplies submandibular gland and submental region. Then here is the gland, submandibular gland. The artery give glandular branches. Then the artery ascend lateral to the superior constrictor muscle. Okay, deep to this muscle is tonsil. So it's going to give tonsillar branch, which penetrating superior constrictor is going to penetrate superior constrictor muscle and supply palatine tonsil. So this is superior constrictor muscle, and here is the palatine tonsil. Okay, so this is tonsillar branch. Then the last branch is called ascending palatine artery. Ascending palatine artery going to the palate. Ascending palatine artery. So how many branches in the neck again? 4 branches: submental, glandular, tonsillar, ascending palatine. So in cervical region we have tags. T, tonsillar, is primary source of blood supply to tonsils, to palatine tonsil. A, ascending palatine, from the name, is going to the soft palate mainly. Anastomosis with descending palatine of ascending pharyngeal artery. Anastomosis with the descending palatine of ascending pharyngeal. G is glandular. To which gland? Submandibular gland. Okay. S, submental. This is the longest branch. Supply also submandibular gland and submental region. Okay, so this artery supply also. So the cervical part, keep in mind, it is the primary blood supply to tonsil and submandibular gland. Okay. How about facial part? The facial part, we covered it before. Again, give inferior labial to the lower lip, superior labial to the upper lip, lateral nasal to the nose, then continue as angular. So superior labial, inferior labial, lateral nasal, and angular. What I like from you to remember here is that the superior labial branches send septal to nasal septum. It is a common source of bleeding from nose. This is called septal. Okay, so the facial part, this part is going to give the facial part of the artery. Facial part of facial artery is going to give 4 branches. Inferior labial to the lower lip, to superior labial, which gives septal, and the septal contribute to anastomosis in the tip of nose, in the nasal septum. This is the common source of epistaxis, which is bleeding from nose. Okay, 3, and anastomosis branches of maxillary and ophthalmic there. Lateral nasal to the side of nose, then angular, which is close to the medial angle of the eye. So this is the facial artery. Facial artery, it is a branch from external carotid, ascend deep to posterior below of digastrics and disappear under cover or under the mandible for very short distance, where it is closely related to the gland, submandibular gland, okay, and submandibular fossa of the mandible, then descend again where it appear at the anteroinferior angle of masseter, like here is the masseter, okay, this is the anteroinferior angle of masseter, then ascend up to the angle of the mouth, about fingerprints lateral to the angle of mouth, then ascend vertical to the angle of eye. In face, remember 3 angles: angle of masseter, angle of the mouth, angle of the eye. And facial part and cervical part, each of them give 4 branches. The facial part give inferior labial, superior labial, which give septal, then you have lateral nasal and angular. in the neck, you have 4 branches, tonsillar, which perforate this muscle, superior constrictor of the pharynx, to reach to palatine tonsil, is going to give ascending palatine, which is going to anastomose with branch from ascending pharyngeal called descending palatine. Then it's going to give also glandular to the gland, submandibular gland, S, which refer to submental, and this is the longest branch. Okay, so remember when I ask you about palate is supplied by multiple branches of the palate, including a branch coming from ascending pharyngeal called the descending palatine, branch from facial artery called the ascending palatine, and also branches from maxillary. When it comes to submandibular gland, supplied primarily by branches from facial artery. When it comes to palatine tonsil, again, primary by facial artery. Facial artery, the submental branch, is the longest branch, supplying submandibular gland, and also supply submental region. And don't forget that it also contributes to vascular canal of the mandible. Vascular canal of mandible, where it anastomoses with sublingual branch of lingual artery. Okay, so you will notice that there is collateral circulation between facial and right side, facial and left side, between facial and ascending pharyngeal, facial and the branches from lingual artery inside the vascular canal, between facial and the branches from maxillary artery also, whether in the palatine region or inside the vascular canal of the mandible. So there is rich collateral circulation. I hope that this is help. Thank you.